The 12th South African AIDS Conference has ended with Deputy Minister Joe Phaahla delivering the closing address. The conference, held in Kempton Park, ran from September 8th to 11th under the theme Unite for Change, Empower Communities and Redefine Priorities for HIV/AIDS. Some of the topics dominating the discussions include the rollout of lenacapavir, a game changer in preventing HIV transmission, currently under consideration by the South African Health Products Regulatory Authority. The implementation of 6 multi-month dispensing involves providing stable HIV patients with a 6-month supply of medication to reduce clinic visits to only 2 per year. Other critical topics include addressing human rights barriers and empowering vulnerable communities through HIV, TB, STIs and GBV interventions, strengthening prevention, treatment and psychosocial support for people living with HIV, empowering communities to end the epidemic by fostering local leadership, promoting stigma reduction. Right, as we expand the conversation, we are now joined by the director of Jacqueline Pienaar, who is the Senior Technical Director and Public Health Specialist at the Aurum Institute. A very good evening to you. Thank you so much for joining us. I mean, if you look at, what's currently what was anticipated insofar as the conference is concerned, new and exciting research and innovation that will help, reduce the numbers and have more people on treatment. I mean, what for you stood out as these conversations took place and, the progress that could potentially change lives?
Fantastic. Thank you. Good evening and good evening to your viewers. That's a great question. So I think one of the primary factors that we discussed at this conference that has created great excitement, since its release in 2024, is the lenacapavir injectable, long-acting injectable PrEP. So it's a subcutaneous injectable that is a pre-exposure prophylactic method to prevent individuals at high risk for HIV from actually acquiring HIV. So this injectable enables, you would get it twice a year, so once every 6 months. And so by virtue of this injectable, individuals would not need to visit clinics regularly. And you also reduce the pill burden and the associated factors related with, taking oral tablets, such as non-adherence, people who miss their doses, and people who just drop off the treatment altogether. So this was a really exciting topic for discussion at the conference.
So in terms of rollout and access and some of the prerequisites, what discussions took place around that space?
So the lenacapavir drug has been approved by the United States FDA in June 2024 last year. It's currently under consideration. It's for approval at the South African Health Products Regulatory Authority, SAHPRA, here in South Africa. And there is marked interest and investment from the South African Department of Health and other funders globally towards increasing the dose, the number of doses that would be made available in South Africa. So once SAHPRA approves and provides the regulatory approval for lenacapavir to be rolled out in South Africa, a lot of the clinics, the South African government, as well as a lot of the partners that are donor funded across the country, are going to rapidly scale and roll out lenacapavir. So we're hoping that, through this process, while we are preparing, we are going to engage communities and increase prevention literacy so that people understand what the drug is about, what the injectable is about, what they can expect, and how effective the drug is. So that by the time we actually get our hands on the drug, that, uptake would be rapid and we would be able, to have great access and improved accessibility to the drug across South Africa.
When you talk about increasing prevention literacy in the interim, what we have uncovered is a big concern when it comes to the age groups of women from 15 to 25. How are you thinking that perhaps an intervention like this can help that segment? And of course, looking at some of the loopholes that are driving up the the infection rates in that age group?
Definitely. So it's a particularly vulnerable age group, that has been vulnerable for, I would say, like the last 15 years, if not longer, specifically towards acquisition of HIV, other STIs, including unplanned pregnancy as well. And by virtue of increasing prevention literacy, reaching adolescent girls and young women. So as you rightfully state, girls ages between 15 up to 25 comprises, engaging with them, ensuring that the messages that we create does not come from a top-down approach, but rather are co-created with the adolescent girls and young women across South Africa. So it's not like a one size fits all or a copy paste model that we develop something in Gauteng and then expect individuals in the Eastern Cape and in the Western Cape to uptake the message. So by virtue of increasing prevention literacy, it means that we will be working across the country in various sectors specifically tailored to meet the needs of adolescent girls and young women, to have them at the table so that we can co-design and improve the way that we reach them, reaching them where they are, so not expecting that they will go to clinics, but actually reaching these young ladies where they are, where they would like to be reached, and reaching them in the manner and using the methods that they would like to be reached and communicated with.
But, you speak about progress on one end, and it does seem that this year's event has shifted the needle in some sort of meaningful way with the new developments. Despite the progress, we're still in a position where the country and the continent perhaps dealing with stigma, gender-based violence, structural inequalities, which still drive these new infections. How were these issues addressed from a policy perspective as well as a funding perspective when it comes to, making sure that there are some solutions on the table?
So I think, as our viewers know, the country and Africa as a continent, as you rightfully state, is still reeling from the impact of, the US government funding cuts. But, we're a resilient community and we have banded together and we are working to, find opportunities and avenues to ensure that our people do not fall through the cracks as a result of the funding cuts. And so, although there has been substantial progress, it is now up to us to ensure that we do not backslide in lieu of the funding cuts, but that we maintain the progress. And to do that, we all need to work together as part of this ecosystem, and the government plays a central role in terms of the new policies that are coming out as we are all working on the new national strategic plan, several guidelines, including the inclusion of artificial intelligence and various telemedicine and telehealth methods to reach vulnerable individuals, specifically individuals in rural areas who might not readily have access to a clinic that are, that's prohibitively too far in terms of transport costs or distance.
Yeah.
In addition to that, this conference also tackled health system strengthening to ensure that we can offer decentralized care in a manner that will still maintain optimum quality assured for all of our citizens in deep rural areas as well.
Very well. Thank you so much for speaking to us this evening. Senior Technical Director and Public Health Specialist at the Aurum Institute, Jacqueline Pienaar, speaking to us there about the AIDS conference that just wrapped up.